Properties of autosomal recessive inheritance. There are certain properties which are usually seen in case of autosomal recessive inheritance. The most common is consanguinity. Consanguinity means the cousin marriages. If there are cousin marriages between the families or inbreeding, that is the main property of the autosomal recessive inheritance. Same allele increases the risk of the disease because there are cousin marriages or the marriages which are within the family, and there is the same allele that inherit from grandparents to parents, from parents to the children. So there is a possibility the same allele that can be a mutated allele is being inherited from the grandparents to parents and from parents to the children. So if the allele is mutated, there is a chance that disease would be greater in that particular family or in that particular population. Common genetic background. These type of the diseases, they usually appear in those populations that have common ancestors, because in a small population where there are intermarriages or marriages within the families and their ancestors are common, autosomal recessive diseases are more frequent in those populations. Like in case of the Jews, Ashkenazi Jews, in which it has been seen that a particular disease, that is Gaucher disease, is more prevalent. Phenotypes are more common in the siblings as compared to relatives. Those individuals, if there is a cross between the two individuals and both are cousin and are carrier of a disease, there will be more children which will be affected as compared to other relatives of the parents. This kind of diseases, they are equally prevalent in both genders. In case of males and in case of females, they are prevalent at gender basis. Parents of the affected individuals are asymptomatic. In case of typical pedigrees which shows autosomal recessive inheritance, we see that the parents, they do not have the disease. Although they are the carrier of the disease, they have one mutated allele and the second allele in the parents is normal. They are the carrier of the disease. Phenotypically they are normal, but they have one mutated allele. So in most of the cases, they are asymptomatic and the disease appears in the children. In case of autosomal recessive diseases, the risk for each of the children is 25% because the parents, they have two alleles and one of the allele is mutated while the second allele is normal. So during the gametogenesis, the allele, they separate from each other. When they combine during the fertilization, so the chance for each fertilization would be 25% being the affected child.